Hello, it's Shivani of SootheJewels.com, and I'm a licensed clinical social worker who specializes in maternal mental health. So I help mothers obtain and maintain healthy mental health before, during, and after pregnancies. So today for Mommy Talk Mondays, we'll be talking about the top 4 concerns of the first trimester. So the first concern would be the morning sickness, and it's a valid concern because 85% of women do experience morning sickness, and morning sickness is the vomiting, the feeling nauseous, just not feeling well at all. It hits hardest in the first trimester, and some doctors believe that the higher the hormones in your body, the more likely you are to experience morning sickness. So basically, morning sickness and the feeling a lot of morning sickness means that your body's doing what it's supposed to be doing. And a lot of times it's the higher the level of hormones in your body, the better outcome for the baby. So it's a good thing to experience morning sickness, but the lack of morning sickness does not necessarily mean that there's something wrong. But if you do feel it and you are experiencing it, just think that it means that the baby is probably doing very well inside your body. So that's a positive thing. So if you're feeling morning sickness, what you can do is you can eat saltine crackers. That can help. Ginger products, so ginger ale, ginger tea, ginger candy could help as well. And just eating small meals throughout the day. Usually by the time you're entering into your second trimester, usually you're not feeling as bad as you are in the first trimester as far as the morning sickness is concerned. So the second concern is miscarriage. So a lot of women, the moment they find out they're pregnant, they are fearful of losing that baby. And I would say miscarriage is a major concern whether you're first trimester, second, or third. Until you have that baby, you're probably going to be afraid that something can happen. So a miscarriage is it's a random act. It's a random act. It doesn't mean that there's something that you did, that's something that happened, anything like that. It's just a random act that sometimes happens. And 70% of first trimester miscarriages are caused by some type of chromosome defect. So that means that if something's not right completely with the baby, the body will rid itself of the baby. So it's one of those things where it's like the survival of the fittest. So if your body knows that it's not a strong baby, that something can happen, that it won't survive throughout the 9 months, or that it won't survive once it's born, then a lot of times that the miscarriage will happen. So 10 to 25% of recognized pregnancies end in miscarriage. So that means once you actually know that you're pregnant, 10 to 25% of the pregnancies will end in a miscarriage. So that's not too bad. So if you think about it, about 75% of pregnancies, once you find out, it will carry on to a full healthy baby. So the remedy, there's really not much you can do about a miscarriage because it is a random act. But if you aren't pregnant and you are trying to get pregnant, what you can do is maintain a healthy diet prior to being pregnant, exercise, and go to your OB and get all your tests done, get all the blood work done, get your STDs checked, just get everything checked to make sure that your body is healthy and that there will be nothing to cause any problems or issues once you do get pregnant. So the third concern is it's the loss of symptoms. So as much as people hate experiencing morning sickness, the loss of symptoms can be even more frightening. So that means that you're feeling sick and then you just wake up one morning and that's it. You don't feel anything. You feel like a normal human being. So that can be the answer to your prayers. But most people are like, what's going on? My breasts aren't sore. I'm not nauseous anymore. I feel great. What's wrong with me? I hope I'm still pregnant. So most likely you are still pregnant. It doesn't mean the loss of symptoms does not mean that something's going on with the baby. It does not mean that you are having a miscarriage. Throughout the pregnancy, the hormones fluctuate. So sometimes you may feel really bad. Sometimes you may feel pretty good. So that's a positive thing. If you're just completely concerned and completely freaked out, you can definitely schedule to see your OB to get all the work up, to get the blood work, to get the hormones checked, just to make sure that everything is going well, and to ease your mind with the pregnancy, just to make sure everything is okay. The fourth is just overall stress of finding out that you're pregnant. So whether you planned on being pregnant, whether it was a surprise pregnancy and you just had no idea that you are pregnant, it can really cause a list of different anxieties. You can be fearful, you can be scared, you can be completely shocked, you can be overwhelmed, excited. You can just have that overall level of anxiety. So what you can do if you're feeling this way is definitely speak with your spouse about just what you're feeling, so that they can kind of talk with you. Just try to ease your mind a little bit. Speak with your family, your close friends about what's going on. You can also just give yourself time. If you're feeling a lot of anxiety over being pregnant, give yourself time to process what's going on. If you just found out you're pregnant, sometimes it takes a few days, if not weeks, to just say, okay, I can do this. This is okay, you know? If the anxiety persists, I would definitely suggest speaking with a mental health professional, someone that can help you process what's going on and process how you're feeling. So those are my top 4 concerns for the first trimester, and if I didn't cover a concern that you may have had, just leave it in the comments below, and if I did cover it, just tell me how you dealt with it. How did you deal with the miscarriage, or the fear of a miscarriage? How did you deal with the anxiety of finding out you were just pregnant? You know, just leave your comments below so that I can engage with you. And if you want to reach me, you can always find me on SootheJewels.com, where I sell fashionable teething jewelry for mothers and fathers. You also can find me on Instagram at Soothe Jewels, on Facebook at Soothe Jewels, on Twitter, I'm on Periscope. You can find me, okay? So I'll leave all that information below. And thank you so much for watching Mommy Talk Mondays. Even though you may be watching it on like a Tuesday or Wednesday, it's okay. It's okay. Thank you for watching, and like the video, and please subscribe and share it to your page. Thank you so much for taking time out with me to discuss the top concerns of the first trimester. You have a great day. Bye.